Neither the El Paso County Medical Society, its members, nor KCUS-TV shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Good evening. Tonight we get to focus on the youth. We get to focus on puberty, and aren't we all lucky? We've all been through it. Some of us are parents or grandparents or aunts or uncles of people who are going through it right now, and it's something that everybody goes through, and there are often issues with puberty. There are issues of pediatric diabetes, there are disorders related to hormones and the glands that produce them. So today we have three doctors that are focusing on pediatric endocrinology and the impact of diet on a child's digestive system and their behavior. As you know, this is a live program, so if you have some questions to ask, give us a call, 881-0013. Tonight we have Mikey Jimeno with us, who is a medical student in her second year, and we also have Valerie Lopez with us, who is also a medical student in her second year, and she is going to be, both of them are going to be answering questions or sending questions our way. This show is sponsored and underwritten by the Hospitals of Providence, and we also want to thank the Texas Tech Paulo Foster School of Medicine, because they're the ones that bring the medical students our way. And as always, a huge thank you to the El Paso County Medical Society that underwrites the show, sponsors the show, brought the show to you for over 20 years, each and every month. Good evening, I'm Catherine Berg, and you're watching the El Paso Physician. Good evening, welcome back. Catherine Berg here with the El Paso Physician, and we are talking tonight about pediatric endocrinology. What does that mean? It's puberty, it's adolescence, it's the time that we all make fun of in our lives that we really hated ourselves, like, oh yeah, that awkward stage. There's a lot of stuff that happens with the body during that time, so there's a reason it's an awkward stage, and we're going to talk a lot about that this evening. We have three very different specialists with us this evening, which is great. We have Dr. Aldo Maspons, who is a pediatric gastroenterologist, and he has decided that after the show, he's going to put on Mr. Rogers' sweater and take a picture at the set.
That's right.
So he's very excited about this hour being over only for that reason.
my son loves Daniel Tiger.
There you go. You see? It's a shout out. And then we have Dr. Shivani Mehta, who is our psychiatrist here this evening. And again, just going through puberty and thinking about it, we need all kinds of psych help. So thank you for being here. And then we have Michelle Zerra, who is a pediatric endocrinologist. And what does that mean is something we're going to ask you in a second. So that being said, with all three of your specialties, let's explain to the people at home what a gastroenterologist does, fine, but how the world of pediatrics really enters that world. So what do you do all day, every day? That's kind of how I ask that question.
Sure. So my name is Aldo Maspons. I'm a pediatric gastroenterologist. I was born and raised in El Paso, Texas. And thank you for having me. Thank you to Providence, KCOS, and PBS. So what I deal with pediatric, it goes from day 0 of life all the way to 22, and you can argue 28. Who knows when you stop becoming a kid. And the digestive system goes, the tube is like from mouth to anus, it's one long tube. Okay, so it's from here to here, mostly this kind of stuff. And it also includes the pancreas, the liver, and the gallbladder. And any problem that happens with that.
Okay.
And so things can be as simple as constipation, belly pain, to as severe as needing a liver transplant. And so it ranges. And so my life can be really stressful or really awesome because I get to talk about farts and belly pain.
I love that you said farts on the air.
That's true.
He even said we can't cuss, right? I'm like, well, it's PBS, buddy.
I guess
that. Let's kind of watch it, but no. So, Dr. Mehta, I'm sure you've had to deal with people like this before. Let's talk about, I would love to, number one, differentiate psychology and psychiatry. And then after that, I would like for you to talk about what you do all day, every day.
So, in simple words, we all work together, psychologists, psychiatrists, but psychiatrists also make treatment plan and prescribe medications. Mm-hmm. And we've gone through medical school, so kind of a lot of times we work a lot in the hospital setting, in integrated care clinics, where we work with other specialists to help them help their kids. Mm-hmm. So that's the difference that I've been talking about.
Okay.
All day, every day. I'm a child, adult, and adolescent psychiatrist. So I see kids as young as 2.5, 3 years, because we're screening them for any kind of developmental disorders and milestone problems.
Okay.
To, kids with attention deficit hyperactivity disorder, defiance. We see kids with eating disorders. We see kids with depression, anxiety disorders, various mood disorders. So what I do is talk to kids all day. And it's fun for me.
I bet it is. I bet it is. Dr. Zeta, we were talking when we were kind of hanging out on the couch over there. It's a different world today in the world of kids and puberty and adolescence. You are dealing with endocrinology, but specifically with pediatric endocrinology. And so there's reasons for, and you said the word defiance. And so we just think, oh, well, that's been going on for centuries. But sometimes there's reasons for things. If you could explain what an endocrinologist does, and then again, specifically with you, how you're dealing with the younger ones. When I say younger, like you said, anyone under the age of 28, I like that. But in general, what's an endocrinologist do?
So a pediatric endocrinologist is a pediatrician who's specially trained in hormonal disorders. So that includes diabetes, growth problems, too short, too tall, too early in puberty, too late in puberty, abnormal periods in teenagers, calcium and phosphorus metabolism disorders, bone disorders, and thyroid hormonal disorder, hypothyroidism, etc. So what I do is I see children who have been referred to me by a pediatrician from the community with various anomalies. And I enjoy that because it's a very interesting problem. And the hormones, unlike Dr. Maspons, they are scattered throughout your body. You have the pituitary hormone, that's the master gland of the body that regulates a lot of the other hormones, the thyroid, the growth, etc. Then you have the pancreatic hormones, insulin. You have the parathyroid hormones behind the thyroid, and the thyroid hormones, they are responsible for a lot of our function, our heart rate, our bowel movements, how we feel, our moods, our development. So I see disorder of puberty as well. And
I'm a problematic thyroid gal and didn't realize it until I was pregnant when hormones started going crazy. So it's an interesting study, just in general, all the different hormones that are working together and sometimes against each other.
Right.
On that note, I'd like to start with, because you're next to me, let's talk about gastroenterology. And let's talk about, from the stomach to the end, how and why do hormones have an effect on your digestive system?
Well, I think, so how do hormones, so it just depends. I think if, the biggest issue I think that there's overlap with hormones would be thyroid.
Okay.
And a lot of times, so if things are really slowed down, so thyroid can manage to make things fast or make things slow.
Okay.
So if you have a really low thyroid, and I'm speaking for the endocrinologist here, but if things are really low, it can slow down all your transit time for eating and stooling.
I didn't ask this first, but for those that don't know, where is the thyroid located?
In the neck, at the base of the neck. It's like a little butterfly, and it can get big, and you can get overgrowth of the thyroid. But some disorder of transit are not necessarily caused by thyroid, but sometimes they are.
Yeah. Yeah.
But otherwise, they're going to send me a very constipated child on a first of the year.
That's true.
You're constipated, go see Dr. Zeta.
It's always something to consider.
Yes.
Whenever there's constipation that doesn't respond to regular treatment, then it's always on the list of possibilities to say, okay, is there thyroid issues going on?
Right. I want to bring up diabetes from the get-go, because that's always an issue when we're talking about gastro issues. And with kids, how do kids get diagnosed with type 1, type 2? We can talk about type 1 and type 2. Some people get diagnosed in their 40s and 50s. That's mainly diet. Some is truly hormone related. Let's talk a little bit about type 1 and type 2 diabetes and what people deem as childhood diabetes. And I know it's not correctly said, but you hear about that all the time. Right. That's how you hear it defined.
Well, Me, in my specialty as a gastroenterologist, so because I deal with liver issues, I usually get kids referred because they have inflammation in their liver.
Okay.
And when I'm seeing them, meeting them for the first time, I usually see some external signs of pre-onset diabetes, which is darkening here in the neck and sometimes darkening in the axilla as well. And that's called acanthosis nigricans. It looks like kind of velvety skin. And so that's kind of my first sign. Usually the kid is a little overweight. And it's an issue that is a lot more prevalent in the Hispanic community. So that, along with inflammation of the liver plus the overweight, and usually it comes along with high blood pressure, equals metabolic syndrome, which is a kind of a constellation of all those things.
Okay.
And risk of type 2 diabetes.
That's right.
So, and that's the big question. So what is the cause then? Or is that, I know there's still, yes.
So in children, still most of the children are type 1.
Okay.
But we see an increasing incidence of type 2 diabetes because of the epidemic of obesity.
Exactly. Okay.
And so type 2 diabetes, we used to see that in older people, but now we're seeing it as young as 9 or 10 years old. And the risk factors are obesity, sedentarity, there are some genetic factors, some racial factor. So it's very common in Native American and Mexican origin Hispanics and other Hispanics and Black people and African American. But we see that also in white people, but in a lesser extent.
Okay.
So this kind of diabetes is due to a problem with the receptor to insulin, and the insulin is not really deficient, but it is not working. And that's why they get, there is stimulation of the pigment cells of the skin that gives this acanthosis nigricans. And one of the side effects of this is that the liver can enlarge and you can have liver disease from this kind of diabetes.
And this is the question where we talk about a person that is, let's say, type 1. And so how type 2, again, is what people think is more associated with diet. So type 1, what kind of diets do you as a gastroenterologist put these, I don't want to call them kids, adolescents, youth, on? Is there specific things they should stay away from, that they should not stay away from, etc.?
For type 1 diabetes?
For type 1. Let's start with type 1.
Usually I don't see type 1 diabetes, to be honest.
Okay.
I think when I do see them, it's because either they have inflammation of their pancreas, which is because of their diabetes.
And they get pancreatitis.
Right, they get pancreatitis.
Okay.
Or sometimes they can get some inflammation of the liver, but it's also just because of poor controlled type 1 diabetes.
Okay.
And so the diet, mostly I say,
So it's
what
more
does the
like my
endocrinologist
field.
say? Yeah.
Okay.
Yeah.
So you're type 1. So on that note, let's go to type 2, because that is more diet related, right?
Well,
Yeah,
so
type
to some
1,
degree.
you still have to be eating healthy and having a good mix of vegetables and protein and avoiding the fast-acting sugars.
Right.
And also, limiting or counting the carbohydrates that you eat. The complex carbohydrates are the breads, pasta, rice, potatoes, corn, flour
All the
products.
good stuff.
You can have it, but you have to dose your insulin based on what you eat.
Okay.
So in general, even type 1 should be healthy eating and exercising and active and
Okay.
off their video games.
Right,
and
exactly.
you know what I
exactly.
mean. And the couch.
Yeah, and the couch. And let's talk about insulin management then, especially in younger ones, because, and there's that funny age too, when they're really young, then mom and dad can kind of, okay, it's time to take your insulin, it's time to, then there's certain like, okay, now I'm in 7th grade or 8th grade, I can do this on my own, but then there's forgetting, there's just issues with that. And I'd love for you to explore a little bit about, again, this age group where puberty starts kicking in, because I feel like that's what I'd like to focus on today, those several years of puberty, and how the system is affected. Just, again, the entire endocrine system, how it's affected.
So, at puberty, the psychiatrist could tell you that it's very common for kids to rebel.
Oh, yeah.
And to want not to deal with their condition. And so it's a very delicate balance for the parents to continue to keep a watching eye on their kid, but still let them get a little more independence. And that's where the problems occur often with poor control of diabetes and missing shots, or so you have to give them some freedom, but you still have to watch carefully.
Dr. Mehta is like scratching in her seat. It's like, I want to talk. So I am ready. You go to town, because I know you had a couple of things you wanted to add.
I just want to add that, I know we talk about how kids, they rebel, but at the same time, look at what they have to go through.
Bingo.
They have to fit in with other kids. They have, everybody else is going to McDonald's and they can't do it. It's very, very hard. You really have to understand that these kids who have known from, very young age that they have to eat all these healthy things and they have to do all these things and they have to constantly inject themselves or, do all these test their blood sugars. They do that, but at the same time, they are trying to find themselves. They are really trying to figure out where they fit in. They are trying to figure out, how they can be with their friends without them, being ostracized. They don't want to be bullied, and it's not just being bullied, but they don't want to be different. And so, it's such a delicate balance for them. Where,
So give me, if you could, without names, without a classic case of someone that is coming to see you, somebody that you're working with who knows that there's a certain way that they have to manage their diet, manage their insulin, but they're angry because, and that has very little to do with diabetes. That's just being in today's world and today's pressure and being that age anyway. But talk about maybe some of the things that may be said to you and how you would react and what you would say back to them.
So some of the common things I see in kids with diabetes, and not just type 1, but even type 2, some of the common things that they come and tell me is that, it's hard for me to follow the diet because I want to go out with my friends. It's hard for me to use, and nowadays there are so many different very, very high-tech machines that they use for the insulin and everything, but the kids ask. These are the kids who have to go to the school nurse and get the insulin shots. So,
and that's a disruption every day too, and that also takes you out of the world of normality, right? And that, I guess that's part of it too.
So, because other kids are going to ask, why are you going to the school nurse? Or why do you have to keep, missing certain days because they have more appointments? Why do you have to do certain things? Why can't you just act normally? Why can't you, why can't you? So, these are very hard questions for them. These are very hard issues, especially at the same time, they are really trying to explore where they belong. They are trying to find themselves. They are trying to figure out who they are.
But on a positive note, we have come a long way. Because children with diabetes, when I started my practice, could never eat sugar. And now they can have some sweets as long as they count them as part of their carbohydrate and can dose themselves. And then they have insulin pump that that can program their boluses of insulin as long as they enter their blood sugar and how much they're going to eat. So it's much better than 33 years ago when I started. But it is hard to manage all these, computers and programming device, and the programming device sometimes don't work. So you still have to have knowledge about the condition.
And if anybody's got knowledge about computers and tech, it's those ones.
Those kids.
Yes. So on that note, describe an insulin pump. A couple of years ago, there was a friend of mine. It's like, oh, well, I've got the pump now, and it's kind of embedded into his skin. And I was fascinated by it. I'm like, show me what this is. He goes, well, it's underneath. But describe to the people at home the shots. That was and some people still take shots, obviously. But the difference between the two delivery devices of insulin. I know there's several delivery devices, but maybe those two.
So the intensive program for taking good care of diabetes involves taking 4 to 5 shots a day of insulin. And before each shot, you are supposed to check your blood sugar. If you're going to eat, you're supposed to count how many carbs you ate and then deliver your insulin. Now with the pump, you have a machine that is implanted. Either it's a little pod that you put on your arm, on your legs, and there is a little, how do you call that, a control, like a phone, smaller than a phone. And you can program all this, and the pump will deliver a basal rate of insulin. And then each time you eat, you enter what your sugars are, what you're going to eat, and it delivers the insulin on its own.
So you enter in what you're going to eat.
How many carbs?
So how many carbs? Okay, so again, pardon my ignorance, I have no idea. So if you're going to sit down, and we're at school now. So now we are in the 8th grade. So we're, how old are we, 13?
Yes,
we're 13
14,
in the 8th grade, and you know, you're at the middle school, and I'm like, okay, fine, I got to enter this in. I got 3 kids at the table. You were talking about trying to fit in. We have pizza today and spaghetti, and it looks like it's good, but then you taste it, it's not great. When do you enter it into the pump?
So
do you do it before, after, and how do they know?
You enter it before, usually, for better results.
Okay.
But if you don't want to eat that gooey pizza, you can go and get 2 slices of bread or a sandwich or something else to compensate for what you injected. Or you can drink 4 ounces of juice, or, you know, as long as you give the equivalent amount of carbs to what you are going to eat.
Right.
So you're not forced to eat what you don't want to eat.
Gotcha. Thank God, right?
Yes.
And so, Dr. Mata, let's talk about that too. As this conversation is going, I'm sure that these are some of the frustrations that these I'm going to call them kids anyway, but don't take offense. I love the word kids. These kids are coming to you. It's like, man, you know, and also an appetite can change by tasting something and you not like it. And then if there's nothing available, which I have a 15-year-old and he's in high school, but that's kind of a thing. It's like, well, if the snack bar sits, it's ham and cheese sandwich and it's awful, then you throw it away and you eat nothing all day long, which I'm assuming is a danger in this age group because they're not going to eat when they're supposed to eat all the time, and they may not like what's there, and so they end up not eating anything at all. So in this world, gastroenterologist may start coming in is how is this affecting their digestive system by not eating or eating just the wrong things, or forget it, there's a Coke, it's just easier, I'm going to drink the soda instead of eating a meal. Is that something that you see as an issue as a pediatric gastroenterologist in those issues?
So I think the biggest issue now is sugar that's consumed in a liquid form.
Okay.
And
that's
mostly
like immediate, right?
It's immediate, and also because the sugar is fructose. And so if you think about Coca-Cola in El Paso versus Mexican Coke, Juarez Coke tastes so much better, and that's because it's sugar cane. And
it's true, though.
the soda from
it. Yeah,
it's better. And here in the United States, it's fructose, so it's a third of the price and 7 times sweeter than sugar cane.
Interesting.
The issue with fructose is that fructose, 100% of the sugar stays in the liver. So it's actually safer if you were to compare drinking a can of soda versus drinking a shot of rum. It's safer to drink rum versus soda, and the reason why. Well, the reason why...
She said that with a wink. I totally saw that.
The only difference is that it's not socially acceptable to drink rum, right?
Yeah.
Because there's
you know what? And
after
expand
effects.
on that, because that is actually very interesting to me, the different types of sugar.
Yes.
Because right now in the media, too, it's like stevia, or you can do agave nectar, or you can do honey. So that guy, explain how those different types of sweeteners enter the system and what they do to your physiology.
Well, it's a breakdown. So not all of those sugars, with the exception of fructose, stay in your liver. So So the reason why you get the after effects, part of the alcohol, it goes to your brain, but also the sugar gets spread out all parts of your body, right? So. But fructose stays 100% in your liver. And the reason why that becomes important is because you have after effects like increased lipid production or fats, and it stays in the liver, and the fat then causes inflammation in the liver. And then it leads to something from non-alcoholic fatty liver disease to non-alcoholic steatohepatitis, which is NASH, or NAFLD, NASH. And NAFLD, non-alcoholic fatty liver disease, right now in the United States...
Say that slower.
Sorry.
Non-alcoholic. It's hard. It's hard.
Non-alcoholic fatty liver disease.
Non-alcoholic fatty liver disease.
And it came about because they meaning these physicians, they would look at biopsies under the microscope. It's like, oh, this looks like the liver of an alcoholic, but it's non-alcoholic. So it must be a non-alcoholic fatty liver disease, right? Because you get fat deposited from alcohol. But so these are people, this is the #1 cause for liver transplantation in the United States is this disease. And it's a silent epidemic because not everyone has heard about this.
Right.
More people know about hepatitis C
Right.
than non-alcoholic fatty liver disease.
Yeah, because you think alcohol, you think liver.
Yes. And so, yeah, hepatitis C is now cured. It's curable.
You know, I don't have that on my paper, but I'd like to talk a little bit about that. But go ahead, sorry.
So people drink their calories. So you're talking about the teenager who's like, well, I'd just rather drink. And so I always go through an exercise with the kids that I see. And mostly I see the kid, but I'm talking to the whole family.
Right.
So I'm gonna take out my phone, okay?
Sure.
All right, so I'm gonna be
I
40.
can't believe I'm allowing this. Okay, go ahead.
I'm gonna check my status. So I'm about 40 years old, and if I drink 1 can of soda, it's 140 calories. So everyone in the audience, you can do this. Okay, if you're 40, we're gonna do a push-up contest right now.
Oh,
No, I'm just kidding.
God.
No. So it's 140 calories. Okay, so you can't really see that, but it's 140 calories in a can of soda, or 2 cups of orange juice.
Okay.
Okay. Times 365 days is 51,000 calories. As a 40-year-old male, I need about 2,000 calories a day. Okay? So I'm going to divide that by 2,000, and that's 26 days of calories that I ate.
Just by drinking.
Just by drinking 1 can of soda.
One can of soda a day.
1 can of soda. So then, if I were to get some seconds or have some cake, all that stuff starts accumulating. And I learned this lesson when I was training as a fellow. So it's really busy training, and I would wear scrubs. And so I gained 30 pounds, and I didn't know because I would wear scrubs.
Ah, right.
Yes.
And-
And when I was a resident, same thing. I gained probably 20 pounds.
Yeah, you let the string out a little.
Yeah.
It's not a big deal.
Yeah.
And so I was newly married, and so I thought, man, my wife is, not to be like sexist or anything, but she was helping me wash clothes because I was really busy in the hospital, and it was like everything was really tight. And I was like, man, what is going on? But it's because I gained a lot of weight.
Right, yeah.
And so...
And you were basically drinking sodas.
I was
It's not
drinking
like
sodas
you
'cause
felt
it's-
like you're eating more, but you were just drinking a lot of sodas.
Yeah, well, because the coffee shops were closed, and I
Right.
needed to stay awake, and so
Gotcha.
I use it for the caffeine.
Gotcha.
Can I
yeah.
just add
Yeah,
something
absolutely.
about
Yes,
soda?
Dr. Zara?
The sugar-free sodas are not better than
Right.
the non-sugar-free because the body doesn't recognize the molecule, like the fructose. So there are studies that just say that if you drink a lot of sugar-free soda, you tend to be hungry because the body doesn't recognize that as a sugar, and you tend to overeat.
I see.
So it doesn't help people that are overweight, and it's certainly not a good thing for diabetic. Personally, I would prefer them have once in a while a little bit of soda than have the diet soda. Absolutely.
So here's what may seem like an overly simplified question, but say that there are people so what am I going to drink during the day? I'm going to a restaurant, and there's iced tea on the menu, which you can add a ton of sugar to, or you can have the 5 colors of packets inside the little square thing. You can have orange juice, fine, but you can have sodas, or you can have water. The best thing to drink if you're in a restaurant, the reason I'm saying a restaurant because you're limited there, versus going at home and you can buy orange juice, you can buy whatever. If you're in a restaurant and you want something sweet with your meal to drink, what is best case scenario to worst case scenario? I'm thinking worst is Coke, or I keep saying Coke is a soda.
The best case
Yes.
scenario is water.
Okay, all right.
You
That's
can put
boring.
lemon,
No one's going to do that. So
lemon
now,
juice, cucumber, ice cubes, whatever.
okay,
The juices, I mean, this has sugar too, but if you count them again and you don't eat that you don't drink them every day.
and if it's a pure sugar, it's a lot better than a fructose sugar.
A natural sugar would be better.
Okay.
But it should be accounted for if you are on insulin, and if
Okay.
you have type 2 diabetes and obesity, you should avoid unless extra special circumstances.
Okay.
Like I have families that eat 2-3 times a week in a restaurant, and
Yeah,
fast
that's
food.
why I'm saying that. This is a really big community who loves to eat
if
out.
you're gonna drink every time something
Right.
sugary, you're not gonna help. So water is the best.
Okay.
Orange juice or lemonade, if it's made with natural sugars, as long
Okay.
as you know how much sugar there is
Right.
in. soda should be a no-no, neither diet, neither...
Okay, so let's now talk about that little square on the table that's got the pink packets and the yellow packets and the blue packets and the psychedelic and the rainbow. So what does one do? Because that's on every single table at every restaurant, and we were talking about, I just came back from Europe. It's there too. But talk about those, because nobody talks about the packages on the table.
Right. So saccharin, saccharose, not good. You know, there are newer natural agave, you know, or I forgot, there is something else. There's a couple of healthier replacement sugar.
Okay, and they really
and
are
if you
healthier.
make your own lemonade, then you put very little sugar. Of course, you can drink that, but in the restaurant they don't do that.
Gotcha, exactly.
So,
yeah. Dr. Mehta, you, again, I love you. You're just like ready. You're so cute, by the way. Can I say that? Am I allowed to say that? But you're smiling. She's like, oh yeah, that. So
just because we are talking about
yes,
soda,
yes.
you know, there have been few studies which have actually shown that consistent soda drinking also causes aggression and attention problems in kids. So, you know, along with all these other health problems, you know, we are just making our kids have more problems behaviorally as well.
Really?
So.
And on that note, within the soda, so there's the sugar. Is part of that caffeine? Is that part, do you know what the makeup is that leads to that, or is that something that's been studied?
So that is not yet clear.
Okay.
You know, there are people who believe it's the color. That's why they try to drink.
Oh, that's right, the coloring.
Right. That's why they try to drink like Sprite or something, you know, non-colored. But you know, the studies were unclear on that. So and whether it is the caffeination, the process of, you know, making the soda, the caffeinate, or whether it is, you know, any other components, it's not yet clear because we need large studies, and it's hard to get like large food studies.
Right, exactly.
Because there is a whole variety of food. Right. But there is also concerns about drinking sodas, about affecting the calcium and phosphorus metabolism and decreasing the bone mineralization in a growing child. You know, they maximize.
Okay, this is endocrinology. So I love where you're going with this. So what I'd like for you to do, because it's part of my questions in here, the way that the different things that you consume affects the different parts of the endocrine system. So the perfect way of starting is when you have sugars, and then when you have like thyroid, we were talking about thyroids. Does a diet matter when it comes to thyroid issues? Hypo is when there's not enough, hyper is when there's too much.
Well, iodine is important, especially if you don't live near the sea. You know, if you live in mountains, sometimes you don't get enough iodine. But seafood replaces that, or if you get too much iodine, that can also affect your thyroid. Too little, too much.
Right.
Phosphorus in the cans of soda can affect your bone metabolism.
Okay.
There is a lot of, you know, we can go on and on the list of stuff. But I think questions would be.
Questions are from the audience. I'm reading this cold, so this is from the audience. How early is it acceptable to put my daughter on? Oh, we're talking about hormones. On birth control, but that's not what we're talking about tonight. So let me wait with that one. But this one, Dr. Zara, I'm gonna ask you about this. And girls are getting their periods earlier, or it seems like they are, and often this is attributed to the type of diet we now have in our day and age. Is that something that and again, I'll give the disclaimer, this is all the information that we have, so we do the best that we can with what's on here, but we can talk about that because diets, I know that there's a lot of talk about milk and the added hormones, if not, and antibodies, et cetera, et cetera. So however you want to attack that question.
You know, in the 1800s, women would get their period at 17 because they were undernourished and there was famine. And now with obesity on the rise, people are getting their period earlier and earlier. And actually, it's not really that their periods are getting earlier, but the signs of puberty start earlier, like the breasts and the shapes. And there is deposits in the fat cells. because we're getting more kids with fat cells, of certain agents that we have in our environment, not only in the diet.
Okay.
So there is a lot of effect of, I mean, I'm looking for the word. But you know, the plastics that are lining the cans.
Yes. I don't know what the word is either, but we talk a lot about it with water bottles and with storage of food.
Right.
Yes.
Exactly. And that has effect on the fat cells, and deposit of this material induce earlier signs of puberty.
Okay.
There are DT, you know, the anti-mosquito.
Oh,
DTT.
DEET. Yeah. Yes.
No,
DEET.
the newer mosquito things, we don't know what they do, but the old ones, we know that they were affecting the breast, and there was more incidence of breast cancer, for instance.
I did not realize
with
that.
the pesticide, certain pesticide.
Different, yeah.
The animals in America are fed with, are actually given hormones, growth hormones,
right.
Estrogens. In certain countries in Europe, there are very strict rules about that. And unfortunately, in our country, unless you buy organic foods and you know that your food is truly organic, we don't have this kind of a safeguard. So there is, we see that earlier and earlier because of obesity and also because of environmental product, what we eat. A diet rich in fats and in protein can actually induce earlier puberty.
And is there a danger to it, or is it just the idea that this is something that everybody, not everybody, but in general, and I know specifically in America, puberty coming on early, and let's talk about the mental health community now when it comes to that. So a century ago, it was 17 years old. Now, some kids as early as 8, which is what I've heard, mainly like 11, 12.
Yeah, the average is 12 and a quarter.
Okay.
So it hasn't changed very much in terms of when you have your period.
Okay.
That's
it's like, and when you say signs of puberty, maybe talk about what the signs of puberty are.
The breast development, we see that earlier. You know, the real glandular tissue and the pubic hair, we see that earlier. But they don't always go into complete early puberty at once. You know?
Okay, yeah. And for the boys, same thing. I mean, puberty is also starting earlier with boys, or is that not something that we're seeing?
A little bit earlier, but not as much. And then we see a lot more fatty tissue, and some young boy develop some kind of chest development, which can be ostracized, you know, very difficult for them. They get breasts and stuff like that.
Okay. I'm going to go back to gastroenterology, the digestive system, for a little bit. And I want to find out from you, it's like, have you been feeling left out? Is that what's happening here? Yeah. You just waved at somebody that walked in, by the way. Who is that?
It's a representative.
Hi, Representative. How do you do? She's sitting on the Mr. Rogers set. I think there's some envy going on there. But I want to talk about, while you're here, because we only have 20 minutes left, the main issues that you see in your world of the digestive system and things that affect the digestive system in the world of puberty. What are those main things? And let's not talk about diabetes, because I felt like we focused a lot on that. But other than that, with different hormones, let's say.
Well, I'm gonna go back to the fatty liver,
because
it truly is under-recognized, and it's a silent epidemic. And I think if families don't pay attention to it now, there are kids who have adult problems medically, and if they don't take care of it now, by the time they're 20, 30, 40, there's kids that have liver transplants because of diet, right? Just
and so fatty liver is that 100% diet caused? Is it partially
the treatment,
both?
So there's definitely some genetic components to this.
Okay, all right.
So if we look like racially, there are differences in terms of who's affected. So white, black versus Hispanic. And if here's a good statistic for you to know who's affected. So 60% of adolescent Hispanic males who are overweight have fatty liver disease. And if you look at
60%.
60%. So 6 in every 10 obese adolescent Hispanic males have fatty liver disease.
Okay, so I'm going to stop here just for a second because we need to define what overweight is. And maybe we can throw out BMI really quick. We can tell people there's a BMI calculator anywhere you look at a search engine. But when you're saying overweight, what does that mean to you as the doc?
It goes over. I mean, it's essentially I use BMI.
Okay.
But
which is body mass index.
Body mass index.
Okay.
But if I have, I mean, I could see, I could. Just thinking back on my childhood, so I grew up here in the 80s, and I know there was probably maybe one chubby kid in my class.
One chubby kid in your class?
Yes.
Okay.
And now, I think if I were to be a student now, back then, I would definitely be the skinniest person. It's changed. And the diet hasn't really changed. The ingredients have changed. And I think like sodas, right? So sodas are different. The Mexican diet's the same, right?
And do you think the movement?
Just ingredients and activity. Yeah, absolutely.
Exactly,
and
the lack of movement,
For sure.
Yes.
Okay.
But the treatment for fatty liver disease, it's the easiest thing, it's the cheapest thing, and it's also the hardest thing. And it's don't drink sugar. That's the only thing. And if they do this and they exercise enough to sweat, right? And I always tell them, just because you go outside and you sweat doesn't mean you exercise. So you have to actually move around.
Okay.
Vigorous exercise.
Enough to sweat. I like that.
And the amount of inflammation trends downwards if they do those two things.
Okay.
Diet and exercise, and that's it.
And if you, like you said, I like how you said, if you want to keep it simple, don't drink sugar.
That's it.
Don't drink sugar. Instead, do we go back to these little packets on the table? And I'm looking at you because we shouldn't drink those either, right? So bottom line is we're trying to
mostly drink water.
Mostly drink water, throw some cucumber. You're trying to wean yourself away from that sugary.
Some people drink the vinegar, apple cider vinegar to melt the
that's another new
away
craze.
A little. But
that sounds like a YouTube challenge or like a don't do that.
So Dr. Mehta, let's talk about kids who want to eat sugar, because I feel like, when do we lose our sweet tooth, or do we ever? But to your credit, and trying to talk to kids about sticking to a diet. Yeah, you're at school now, and I think candy machines and mini soda machines, I remember back in the day, I used to work at the Cancer Society years ago. Yes. And the idea there was, first we're going to try to ban cigarette machines. Don't kill me, those that didn't like that. And then the other idea was at least trying to get soda machines out of the elementary schools first, and then just kind of building from there. It seems like it's a society of all you health Nazis trying to get this stuff out, but there's a reason for it. In the world of psych, and you're talking to kids, and they're bothered, and it's like, I'm aggravated because I need my Coke or my Dr. Pepper or whatever. What kind of conversations do you have in this area?
So, like everybody has talked about exercise and diet, one of the things I explain to them, because a lot of kids, and I'm going to use the word kids because, to me, there are so many different age ranges. Yeah. But one of the things is, for kids, it's harder to take medications, be on the medicine, for whatever reason they have to be on. So one of the things I explain is there are so many studies which have shown that, healthy lifestyle, which includes appropriate diet and exercise, it helps with their mood, it helps with the anxiety, it helps with just feeling good.
Right.
So self-esteem, right? So I turn it to what is it that you really want to achieve, rather than, just all these things I have to give up. We make it, what is your goal out of this? Why are you here? Are you here to get better, or are you here because, you're going to have this tug of war with me? So, we really turn it to, like, what is it that they really want? And then that's the way we would try.
And now we're going to take some steps to achieve that.
Right.
Nicely said. Dr. Zertal, I'm going to go back to a question that I had earlier, because it does kind of talk about what some of these other questions are. Let's talk about someone who started their period, and now we're looking at a little bit older in puberty, saying high school and starting college now. And this is a real question of parents, moms, and girls, and when they are safely able to start on birth control pills. And maybe we can talk about hormones that maybe it's for birth control, but maybe it's also to help regulate periods, help regulate mood, help regulate all this kind of stuff. Exactly.
ovarian
Yeah, so if
syndrome.
we can kind of take that angle into it, because that's also talking with Dr. Murta was talking about. I mean, it's for birth control, fine, but there's all kinds of other issues that are either helped and or affected by birth control pills.
Usually, I mean, you don't go by age so much than by why are you wanting to use the birth control. Mm-hmm. Is it because you have a medical condition? Is it because you have delayed development, let's say, and you don't want to have periods all the time, so you can take every 3 months medication and so on. So we go by what is there a problem, and what are you trying to do with the birth control? Are you trying to prevent pregnancy, or are you treating something physiological? Mm-hmm. And then I've had children, I mean, you don't want to start immediately at the onset of the period. You probably want to have them have at least a few cycles, I would say, before they start. So I can't give you a number.
Yeah.
But I mean, I have had children who have a bleeding disorder, and we use the birth control to help them with these things. So I would say it could be 12, 13, 14, depending on the child, when they started.
Okay. And let me show you or read you the follow-up question to that original question. It says here, when you're overweight and having headaches, when you know that you should start taking some kind of birth control pills, how do I know that this is something that will help me? And this may be a child that's calling in or a parent of a child calling in who has heard, well, if you start the birth control pill, then all these problems are going to magically go away. And I guess that's what I'm trying to get to, is to, again, it's not an age, but what's symptoms is the wrong word too.
The question is, I'm not sure.
Is when someone should start thinking about taking birth control pills, not necessarily for birth control, but for being overweight, for having headaches, maybe when you're on your period, maybe the cramping, all this other kind of stuff. Do the pills help with that?
Headaches are not going to be cured by the pill, actually, because of the estrogen that may aggravate them.
Right, good point.
And it's not going to fix obesity either.
Right.
But it may help with menstrual disorders or problems like hirsutism, irregular periods, and stuff like that, or bleeding.
Right, right. Another question here from the audience. I'm going to throw this Dr. Maspon's way. Can I give my kid diet soda since my physician said it was healthier? We just talked about that.
Yeah,
I'm not a big fan either. So the reason I brought it up is because we just talked about it, and sometimes, and it's nice that we don't know who this person is or who the physician is.
No, it's.
But
I get that a lot.
Okay, you do.
Yeah, and there's been studies that look at if they have a group of kids, adolescent kids, and they give one group sodas, another group water, another group milk, another group diet soda. The kids, the adolescents who drink water lose weight. The ones who drink milk gain a little bit of weight. The ones who drink diet soda gain weight.
Interesting.
Yeah.
Diet, and we're talking diet soda.
Yeah.
Because again, what you were talking about is it kind of tricking your brain, going, I still want sugar, so
yeah,
give me
it's
something
not
else.
full. I want more.
Yeah, nicely said.
And milk. Low percent milk is not
I'm a
bad.
milkaholic. I mean, if you take milk away
especially
from me,
in puberty, you need to grow those bones.
Right.
I don't know. I'm not a big milk fan, and this is the
I
example.
know, people grow out on it. I love it.
So milk, so half the world lives in China, right? There's a lot. I don't know exactly what the population in China is, but when you go to a Chinese restaurant, where is a cheese dish in a Chinese restaurant? Or milk-based dish. Like, you don't really need milk. It's a marketing. Sorry, they do soy, so you need calcium.
Soy. Yeah. And they eat
milk
green
is a marketing
leafy
thing.
vegetables.
No dairy.
Man,
no
you
dairy.
give me some cheese. We joked about we joked that there's wine in these cups. There really isn't. But we thought we should have wine, and I'm thinking wine and cheese. Nothing could go better in the evening for me than have a glass of wine and some cheese.
But
Dear
milk is
Lord.
like
Except for the cholesterol.
You and I cannot be friends. So we might rethink this whole Mr. Rogers thing.
Nothing cool happens over a glass of milk.
Okay, I disagree. Another question here from the audience, and we're going to Dr. Mehta for this. 12-year-old, very anxious. Again, we know very little. Very anxious person, pulls out hair. Mother realizes that medication is an option, wonders if there are other options. So I'm assuming that this type of scenario, we can also give out a telephone number that somebody gave me earlier, happens, I don't know, a lot, maybe a lot, but anxiety, depression, whether it is associated with the endocrine system or not, it's the pressures of the world. I'm throwing this out to you. Take this and do with this question what you will.
Okay. So, to answer this question, one of the first things is safety comes first. So with this, if, this is very limited information, but if with this, there are safety concerns like, the child is, not talking, suddenly now they're talking about hurting themselves, hurting other people, with the anxiety, they are, they're cutting themselves, or there are other safety concerns, then, one of the first things we have to do is get an immediate psychiatric evaluation.
Exactly.
And, after that, what the follow-up discussions are, whatever the physician, mental health provider, whoever they are seeing, they can, guide them better in that. If this is all they have, and, parents are pretty, pretty concerned about the medication and their side effects, again, you really need to start with talking to your doctors. They know you well, so they can really guide you with that.
Exactly.
Therapy, where child goes for individual therapy or with the family, is extremely, extremely beneficial, but only if you are going to be consistent with it. Especially for depression and anxiety in kids, therapy has great role. There are some kids who really benefit from, group therapy where they have peer support. And, when you talk about kids with diabetes, and we were talking,
exactly.
One of the things
They're
we
not
really promote are, peer support and groups. Getting support from other people, family members, community.
Religious sometimes.
Right.
Some people turn to that.
And school. Schools have so
Counseling.
many resources. If you really approach them, they can also help you. So, but one of the first things is to, really recognize that there is a problem, talk to your doctor, and get the right help as soon as you can.
And I do have a number here for those of you that might be in this issue. Providence Children's Specialty Clinic. This might be a nice place to telephone, at least to start the conversation on who you can talk to, what might be the best way of getting your child to be seen. But that number is 577-7888. And again, that's the Providence Children's Specialty Clinic that does have psych evaluations, just everything that we've been talking about this evening. We can call that number, 577-7888. So it's always good to know that. Oh my goodness, I feel, yes, Dr. Mehta.
If there is really a safety concern, calling 911, going to the nearest ER, or just calling the suicide hotline, these are like, really, really important things, and we really want to listen to our kids. It's very, very important. They are
you just touched base on a very serious subject that I'd actually like to do an entire program on sometime relatively soon. I'm a mom of a 21-year-old and a 15-year-old. You hear about suicides. There was one this week very close to where we live. We talk about it at home. It scares the cuss word out of me. And what does one do when you start having issues and you don't know that your child is under such pain? It could be because of diabetes. It could be that puberty is setting. It could be just in general this age. I don't know if you know the number for the suicide hotline, but I will say right now you can, as people say, you can do the Google. Do the Google, search it, just look for Suicide Prevention Hotline, wherever you might be, it's a 1-800 number, and call it. Whether you're a parent, if you're a child watching, or if you're, because we were joking, who watches PBS? It's all the educated old people, right? But if you're in the kitchen right now, that 14-year-old who's getting a glass of milk and putting some chocolate in there to have some chocolate milk for the evening. So if you're listening, there's a suicide hotline that you can call. Just Google it, and it's very, very important. That, like you said, safety is absolutely first. We have 4 minutes, and I want Dr. Zera to talk about something that we either haven't touched base yet that you want to talk about, or something that we may have talked about a little bit, but you want to make sure that we get across to the audience before we end the show.
Well, about diabetes, I think there is a lot of misconception between the type 1 and the type 2.
I agree, yeah.
Type 1 is mostly occurring in young children below 20, but there are some people that can develop type 1 after 30. And the juvenile diabetes, they call that juvenile, but you can have diabetes and not have type 1 diabetes. Like I said, at 9 years of age, you can have sedentarity, obesity, or genetic risk factor or parents. So the type 1, the signs and symptoms, and type 2, sometimes also the symptoms and the signs are the most important thing to remember. They may lose an excessive amount of weight. I have had kids that they thought they were losing weight because they were on a diet, but they lose a lot of weight rapidly. They pee a lot. They wake up at night to pee. They may be bedwetting. Kids that were toilet trained all of a sudden wet the bed. Drinking a lot of water, always hungry all the time. Talk to your doctor and have them check your blood sugars and make sure you don't have diabetes.
Okay. And I think, is that a normal test nowadays? If someone's getting a blood test for anything, is diabetes, I feel like diabetes is always checked, at least in my...
In our group, age group, yes.
Okay.
But in children, not always.
Okay.
But if there are symptoms like that, you really want to mention this to your doctor and have them check for that.
Okay. I have a question here from the audience, and it goes specifically with what you're talking about. How young is too young to start taking insulin is the question.
We have babies, newborns that have congenital diabetes.
Brand new babies.
Brand new babies.
Okay, and how does one, and I know we have a very little bit of time, but how does that regulate? So if we're looking at just breast milk and trying to find out how much
well, we give either a very small dose or dilute insulin. Sometimes we put babies on a pump. It's very difficult. At this age, it's very, very hard.
And how does one know that they have diabetes? Is that something that just through the mother they're going to know already that when the baby's born, or is there a test in the very beginning?
The babies may be in the intensive care unit for something, and then incidentally they see the blood sugars being high. That's how they are diagnosed.
My goodness, this has been a great show. I could use another 2 hours with you guys. We have less than a minute. So I want to say thank you very much to Dr. Maspons, Dr. Mehta, and Dr. Zara. You guys have been fantastic and great. I want to say thanks again to Mikey and Valerie for taking all the questions. They're really lovely, too, of everything that was put in here. And my apologies when the birth control question came up. I thought, I want to get to that, but just a second, so I hope nobody took offense to that. However, I want to say again, thank you to the Hospitals of Providence. The number again for the Children's Specialty Clinic, 577-7888. I want to say a huge thank you to the El Paso County Medical Society because, again, this show was brought to KCOS by them over 20 years ago, and it's still going strong, so that's super helpful. We're also streaming live on Facebook, and please know that we're here several Thursdays a month. I'm Catherine Berg, and you've been watching The El Paso Physician. Good night.